Hello, my name is Philip Sappi. This presentation will guide the staff at our hospital to understand the basics of the care coordination process. After this lecture, staff members will have a better understanding of how care coordination improves patient outcomes. Care coordination is a service that enables patients to better manage their illness or disease. Patients are provided education on their daily care needs through exceptional collaboration between the patient and the healthcare team. To improve the outcomes of this collaborative process, nurses must utilize strategies that are proven effective in scholarly literature. To improve the care coordination process, nurses must provide quality education to each patient to improve their health outcomes. According to the healthcare publication company Elsevier, educating patients with clinically proven information, quote, empowers patients with the knowledge to properly care for their condition, unquote, Elsevier Clinical Nursing 2019. A patient is provided information and training specific to their condition will develop self-efficacy. Depending on the patient's specific needs, the nurse shares information through the forms of written literature, verbal education, and physical demonstrations. The second strategy to developing a proper care coordination collaboration is to ensure that the patient's care plan is individualized. Each patient is unique and requires a plan that is tailored to their individual needs. Patients should not be categorized solely on their disease or illness. According to Rendell Bolton, in the study analyzing personalized care planning in long-term care, a care plan that is individualized, quote, must go beyond simply asking patients a series of questions to establish a plan, unquote, Bolton 2019. Nurses should be open to listening to the patient's concerns through active listening. Questions presented to the patient by the healthcare team should target the overall goal of treatment established by the provider and the patient. Additionally, the finalized care plan should address each concern that the patient had presented in the initial discussion. By providing patients with an opportunity to freely discuss their healthcare concerns, the collaborative experience will have improved outcomes. Change management and patient-centered care. Change management is a necessary process for organizations to improve workflow and collaboration. Ultimately, this process will lead to improved patient outcomes and satisfaction. According to Per Nelson, in an interview study on organizational change, a proper organizational change leads to, quote, improved patient experience and increased patient involvement in care decision-making, unquote, Nelson 2020. There are several prominent theories for change management that organizations can utilize before implementing an organizational-wide change. The aspects of each change management theory are aimed to improve a system-wide process that enhances the patient experience. For example, change management theories often require enthusiastic staff participation and established timeframes to achieve the original organizational goal. When organizations effectively implement organizational change, then change management has the opportunity to improve patient outcomes. Change management theories have been proven effective in clinical settings. For example, Angela Carmen conducted a study involving organizational change within a rural Kentucky healthcare system using Coder's 8-step change model. This organizational change implemented several ideas to improve patient experiences. Most notably, the organization's change, quote, requires that patients' medical records are assessed before all visits so that the clinic is prepared for the original purpose of the visit, unquote, Carmen, 2019. Through effective change management, patients can experience a myriad of improvements in the care they receive. Change theories have the potential to improve patient satisfaction and achieve health goals. Care coordination and ethics. When coordinating patient care, the nurse should make decisions that are ethically motivated. An ethically motivated care plan is centered around a patient's health needs and goals. The nurse works for the best interest of the patient's wishes by informing the patient of all available options of care. Patient care coordination decisions should follow the main principles of ethics in healthcare: autonomy, justice, non-maleficence, and beneficence. Autonomy refers to the patient's ability to make informed healthcare decisions without bias from the healthcare practitioner. A patient is considered informed when they agree with and understand the prescribed treatment plan. Additionally, the nurse should make the patient aware of alternative treatment options. Religious and cultural differences are a significant factor in ethical care planning. The American Nurses Association's Code of Ethics recommends that nurses continue to, quote, respect patient values and decision-making processes that are culturally hierarchical or communal, unquote, American Nurses Association, 2015. Different cultures have varying views of autonomy. Therefore, the nurse should learn how the patient's culture affects their care decisions. Justice within healthcare promotes the practice of fair and equal care. Nurses can promote justice by treating each patient with the same level of respect. Each patient should receive adequate education on their disease or illness. The Nursing Code of Ethics underscores the idea that a nurse promotes justice through, quote, content, clinical, and field experiences, and critical thought, unquote, American Nurses Association, 2015. The patient's care plan should reflect the goals and values of the patient. A plan of care would be considered unjust if the care coordinator demonstrates implicit bias. Therefore, nurses should recognize their own implicit bias to avoid unequal treatment. The principle of beneficence would require the nurse to create a care plan that promotes the welfare of the patient. This care plan would promote a patient's physiological and psychological care needs. Beneficence often conflicts with autonomy during the care coordination process. Nursing care coordinators should be prepared for complex scenarios where the provider attempts to promote care conflicts with the patient's autonomy. The principle of beneficence is closely related to the principle of non-maleficence. The nurse must practice non-maleficence, or to do no harm to the patient. The principle of beneficence can conflict with non-maleficence when patient harm is unintentionally caused by the treatment. To avoid these scenarios, the care coordinator must determine if the benefits of a treatment outweigh the risk to the patient. By following these healthcare principles of ethics, nurses are able to coordinate and deliver care that is ethical. The understanding of 4 principles of healthcare ethics is crucial for care coordination. Patients greatly benefit from care plans that are delivered by ethically motivated practitioners. The impact of healthcare policies on care coordination. Healthcare professionals work within the expectations and boundaries enforced through healthcare policies. Therefore, patient outcomes are heavily influenced by healthcare policies. Understanding prominent policies is necessary for nurses involved in the care coordination process. Healthcare policies can either hinder or bolster patient outcomes. Nurses are a driving force in healthcare policy change when policies negatively affect patient experiences. There have been many strides in promoting positive healthcare policies to improve patient care. For example, the Affordable Care Act increased the healthcare service coverage of patients with Medicare and Medicaid. This act underscored the need for positive patient outcomes in order for hospitals to receive reimbursement from Medicare and Medicaid. This method for reimbursement encouraged hospitals to, quote, implement new programs by creating, quote, care coordinators who make sure that patients are getting appropriate follow-up care, unquote, Isola 2023. By implementing this policy, patients are given additional support that may not have been offered to them years prior. There are policies that still limit care accessibility, which negatively impacts patient outcomes. Patients may not be able to participate in an in-office health visit due to various social and economic barriers. Policy changes during the COVID-19 pandemic led to an increase in telehealth availability to counter this problem. Under the 2023 Consolidated Appropriations Act, there was a temporary change to Medicare that stated, quote, telehealth services can be provided by all eligible Medicare providers, unquote. Health Resources and Services Administration 2023. Unfortunately, this policy is not a permanent implementation to the federal legislation. The policy is only enacted until December 31st, 2024. When this policy ends, Medicare providers will have the ability to discontinue the service to patients. Until policies are permanently implemented, this patient population will experience a deficit of care. This concludes my presentation on care coordination. Thank you for watching.